Imagine having the capability to save someone's life. There is a possibility that we can if we group together and advocate for mental health professionals to respond to emergency calls. There is a need for mental health counselors and professionals to respond to on-call scenes. There would be lesser rates of self-harm emergencies. If mental health professionals were to be on scene for emergencies, they would be able to save so many lives. I often wondered about this type of issue myself. I wondered what would happen if mental health professionals were to respond to mental health emergency calls. If we group together and advocate on this issue, we would be able to help so many people struggling. Today, I want to tell you about mental health professionals responding to emergency calls, responding to mental health situations because there is a need for professionals on the scene and there would be lesser amount of self-harm in these situations. If we group together and advocate on this issue, it would save so many lives. So, what's the big issue? EMT and police are trained professionals to respond to emergencies, but sometimes there are emergencies where they are not trained in order to handle them by themselves. For example, mental health calls and emergencies dealing with mental health. Sure, they have some training on the grips of mental health, but mental health professionals have more training and deal with these situations like this on a daily basis. They know the right words to say and when to say them. Let me inform you about the different kinds of mental health professionals. A psychologist can evaluate the mental health of an individual. They use interviews and tests to establish a diagnosis. They specialize in the diagnosis of treatment and mental health issues. During their specialized training, they study the brain's functions and the complex relationship between the body and the brain. They are qualified to distinguish between physical and psychological causes of mental health and physical distress. They are also the only one type of mental health professional who are licensed to prescribe and monitor medications. Psychologists have a degree in psychology and are experts in human behavior. They use scientific methods to study the factors that influence people's thoughts, perceptions, emotions, and actions. They use evidence-based strategies and interventions to help people overcome challenges and cope with life issues such as relationship problems, parenting issues, challenges in adolescence, lifestyle effects on health, and chronic illness. Psychologists use their clinical skills to work with people who have mental health issues like anxiety, depression, eating disorders, panic disorders, and substance abuse. Counseling is a type of applied psychology that focuses on helping people resolve emotional, behavioral, or social problems arising from various life situations. This could include issues at the workplace, school, college, conflict within the family. It could go on and on. Counseling uses various structured procedures, either through directive or non-directive guidance, for the person to make rational decisions. Counseling work is completely confidential. Counselors can have varied length of training, from a year-long to intensive training to a few months by correspondence. A counselor is a trained professional in the art of listening and has skills to help a person analyze their problems to find a solution. Counselors deal with various issues that are broad and varied, such as those undertake psychologists, psychiatrists, and psychotherapists. If the counselor observes that the counseling isn't addressed in the person's needs because the underlying condition is severe and may need other interventions, they refer the person to a more qualified mental health expert for a diagnosis, treatment, therapy, or medication, as the case may be. Psychiatric social workers are mental health professionals trained to help patients find solutions to many life and social issues that come with mental illness. A patient's relationships, career, and quality of life are significantly affected due to the illness, and this can be very difficult for situations to navigate. Social workers help patients cope with some aspects of their lives. Psychiatric social workers do the following as part of their regular duties. They assist the patient's emotional, social, economic, and mental health needs. They educate the patient and the family members about the illness and help them understand the patient's treatment plan. They value the patient's sociology status and look for community resources that would be useful for them. They create a plan to interrogate patients back into the community, and overall, they play an important role in helping patients have a smooth transition back to family and community. So, as you have heard, mental health professionals are highly educated and trained in dealing with many mental health emergency cases or any emergency case. So, what are the EMTs and police trained in? When emergency medical services professionals respond to calls for help, there is always an element of the unexpected. In some cases, a call is known or suspected behavioral health emergency, but there are other times when behavioral health issues appear only after EMS professionals arrive and assist the situation. Behavioral health emergency calls happen more often than you would expect. In the 2018 ESO-EMS Index, behavioral emergencies were more frequent than diabetic emergencies and about 5 times more frequent than cardiac arrest responses. Behavioral health emergencies can take several forms. For example, EMS professionals may be called to respond to individuals suffering from mental health crisis, intoxicated individuals due to alcohol, drugs, or both, patients or bystanders with disorders such as Alzheimer's or dementia, or patients responding with mental health who present a danger to themselves or others. Communities are experiencing increases in mental health calls due to the COVID-19 pandemic, and the expectations are also rising for EMS workers, while many local governments are obtaining not to send police officers to certain types of emergencies, including mental health ones. Effectively responding to mental health calls require more than simply teaching first responders how to identify dangerous patients and situations, but also how to react to them. For example, EMS training focuses on building rapid with patients and determining when to allow them to have physical control over the situation and when to let the EMT or paramedic should take control of the situation. Learning when and how to safely restrain patients is a critical consideration, as violence against EMS workers is still a concern. Finally, improving communication and collaboration both within EMS teams and between the various agencies involved in the emergency responses, including 911 dispatchers and hospital staff, is another vital part of ensuring safety for patients and EMS workers alike. The EMTs do respond and do receive some training on mental health situations, but it is nothing compared to what having a mental health professional is on scene. When arriving to emergency mental health call, they always don't know what the person is dealing with until they arrive on the scene. Some of the different illnesses they could see are the following. Depression. Depression is more than just a feeling down or having a bad day. When a sad mood lasts for a long time and it interferes with normal everyday functioning, you may be depressed. Some symptoms of depression might include feeling sad or anxious, not wanting to do activities, or feeling irritable. Anxiety is also one. Anxiety is an emotion characterized by the feelings of tension, worry, thoughts, and physical changes like the increase of blood pressure. People with anxiety disorders usually have recurring intrusive thoughts or concerns. Bipolar disorder is also another one. Bipolar disorder is a chronic mood disorder that causes intense shift between mood and energy levels. With now knowing all of these mental health illnesses, we can make an assessment of why mental health professionals should respond to emergency scenes. Nearly 80% of responders said mental health professionals, not police, should respond to mental health and suicide situations. In the TED Talk I chose, she talked about the situation with mental health professionals responding to those emergencies. The CAHOOTS program reduces the confrontations involving police officers and saves money and allows police to concentrate on law enforcement. The mental health professionals are trying to provide the support they need, and they will be there to support throughout the entire situation. I believe that they should be on call for all mental health professionals on the scene. They could help people all over the place. That's why we should all advocate on this issue to help spread awareness and to help people from around the nation.